I'm Kara Tenenbaum. I'm with the Ovarian Cancer National Alliance, and we're sponsoring this briefing with Senator Stabenow. And we're so glad to be here and to be able to share with you ovarian cancer priorities. I'd like to start by welcoming Dr. Coukos.
We appreciate your efforts and we appreciate your dedication, and hopefully we can explain to you why this is such an important moment to input more investment, more efforts in ovarian cancer. The facts are as following. We have about 25,000 women diagnosed with ovarian cancer every year. 15,000 of these women die every year from ovarian cancer. Unfortunately, the majority of women with ovarian cancer are diagnosed at a later stage. Is this a question of biology? Is this a question of luck? Is this a question of lack of resources on our end that we don't diagnose disease early? Probably all of the above, but we can actually change these facts. But more money is needed in our efforts in research. We now have data showing that increasing the frequency of ultrasound, pelvic ultrasound, combined with serum tests, with blood tests, will increase our ability to diagnose ovarian cancer earlier. And we have new biomarkers in the clinic that are being tested or in the laboratory that are being developed. So this effort requires more investment so we can materialize it, bring it to the clinic, test it, and find out how effective it is. As I mentioned earlier, we now have new genes that were just discovered, fresh off the press, that increase the risk for ovarian cancer. These genes need to be translated clinically. We need to find out how many of women in the general population are carriers of these genes and what the impact of those genes are so that we can validate those early studies and translate them into a clinical practice. And we have now moved every decade adding to our success. And these days, 60 to 70% of ovarian cancer patients at late stage achieve complete response with the current therapy. The problem is that within a year or two will recur, and after they recur, it's very hard to cure their disease. So we have not been able to impact the long-term survival of these patients. But there are new therapies that are now at our reach, and they need to be tested in the clinic. Thank you very much for your dedication and your presence here today.
I'd like to share the survivor's perspective with all of you and really focus on the importance of awareness of symptoms because there is, as Dr. Coukos referenced, no diagnostic yet for ovarian cancer, which makes a stage 1 early stage diagnosis that much more challenging to achieve. Every 7 minutes, a woman is diagnosed with a gynecological cancer. And my turn came on March 10th, 2009, around noon. I was 32 years old. I thought I was a healthy professional living the high life in my early 30s. I ran a 10K less than 6 months before I was diagnosed. It took me about 6 months from the time I first spoke about these symptoms with my doctor, with my gynecologist, not primary care, but a gynecologist, to actually receive my diagnosis. So it is a challenge to get diagnosed with this disease, particularly when you are a young person who doesn't fit the profile for this disease. I think Johanna's Law is so important because the funding for the law allows for public awareness and outreach campaigns. This ad being part of the materials for the campaign. I think it's important because the symptoms are the critical, one, being aware of the symptoms that they're exhibiting, keeping a symptom log, understanding what all the symptoms are for various gynecological cancers are their key to getting an early diagnosis. And without a public awareness campaign like this, frankly, to educate both primary care and gynecologists, as well as patients, how else are people going to start getting those early diagnoses?
So my name is Rima Fakih and I am Miss USA. And I'm very proud to hold this title for the reason that it empowers me to assist in the awareness of ovarian cancer. I'm here today as an advocate of the Ovarian Cancer National Awareness. I'm in a unique position of promoting education and early recognition of ovarian cancer and hope to raise awareness for continued funding. Research has shown us that if we educate women about the subtle symptoms of this disease, it will increase early detection, which will greatly increase survival. Since 1997, OCNA has been making a potential difference to make this disease go away, and funding for this research is essential. Today is a day to cast your vote and help make a difference. So on behalf of myself, our speakers, and OCNA, I just want to say let's save some women's lives. Thank you so much.
We've heard from a number of different people. We've heard about the statistics about ovarian cancer, the need for research funding, the need for awareness. Would you like to ask any of our panel any questions?
Unfortunately, not in every case there's large tumors. Mine were many small tumors all over my ovaries. So even though I'd been to the doctor, I had normal pap smears, all of these things that you think that you're checking the box on, I still had cancer all over. I was diagnosed at stage 3A because they were small tumors.
So Dr. Coukos, is there a way for women to prevent ovarian cancer?
The majority of the symptoms that one presents with are very non-specific. So one has to take into account and be worried about the accumulation of a constellation of symptoms, not just one. Being very assertive, being aggressive. If you have symptoms like that, you have to seek the attention of your primary care physician, ask for an ultrasound, and then go down the steps of differential diagnosis very aggressively. But again, I think the most important thing that one has to, the most important message one has to take home is that we really need money invested in research so that we can materialize the promise of the new genes that we can use to screen patients for risk for ovarian cancer, new biomarkers, develop blood tests, new imaging tools to increase the sharpness, the specificity of what we have today in the clinic.